All right. So good afternoon, everyone. So I hope you're having a good day today. So for this afternoon's topic, we are going to discuss briefly about the descriptive study design. No? Again, I'm Dr. Ana Angelica Macalalad Josue. Okay, so basically a descriptive study designs in general have two types, no? The observational type, no, where we just observe the population at the beginning to the end, and interventional studies. So interventional studies are those that we give the population an intervention, for example, a drug, no, or an educational material, or what are some examples of interventions? A dietary regimen, no? So we sort of introduce something to them and see what its effect is on that population. An example of that would be randomized controlled trials. But for this afternoon, we're going to focus on descriptive study design. So descriptive study design is a type of observational study design. So observational study designs have two types, descriptive and analytic. Okay, so when it's descriptive, we don't really do statistical, inferential statistics. No, inferential statistics are statistics that tests hypotheses. In analytic studies, we use inferential statistics. So usually in descriptive studies, we only use descriptive statistics. So what are examples of descriptive statistics? Mean, median, mode, percentages, frequencies. Sometimes you can also use correlation, no? But these are largely just to describe the population. So descriptive studies are usually the first foray into a certain topic, no? So meaning it's been dubbed as the first scientific toe in the water. No? So when we're just trying to discover things about the topic, we usually start with just a descriptive study, nothing very fancy. No? So it has been defined as studies that are concerned with and designed only to describe the existing distribution of variables without regard to causal or other hypotheses. So you're not trying to establish cause and effect relationship, no? So it doesn't mean that in this population there is an increased frequency of ganito, this factor causes this effect, no? So it just aims to describe the phenomenon, no? And then usually from this description, if we are able to see some relationships, then these relationships undergo rigorous testing to determine, to answer certain certain questions, no? You generate hypotheses and test whether that hypothesis should be accepted or not, no? So we have the descriptive penta. Usually in a descriptive study, we answer 5 questions, no? Who, what, when, and why. So who, what, when, and why. And then the implicit 6th question is, so what, no? So we'll describe each W, no, in the succeeding slides. So in the what, we answer what is the condition or disease being studied. No? Here, we develop a clear, specific, and measurable case definition, which is an essential step in creating descriptive study. No? So for example, you want to, these are diagnostic criteria by certain societies. So for example, ano bang example? The diagnostic criteria for acute myocardial infarction. So in acute myocardial infarction, usually the diagnostic criteria is characteristic chest pain, you know, characteristic chest pain with or without ECG changes, characteristic ECG changes, or characteristic elevation in liver enzymes, no? Another criteria would be the criteria for the diagnosis of diabetes, no? So usually there is a case definition that is established before you are able to do a descriptive study on that condition, or there are certain conditions that are described, and from that description, we are able to create a diagnostic criteria for that condition or disease. Okay. Next, the who. Who has the disease in question? So here in these types of descriptive studies, no, we describe the population who has the disease in question in terms of age, sex, race, occupation, even presence of recreational activities, presence of comorbid illnesses, no? So we just aim to describe their clinical profile or their demographic profile. No? So who has the disease in question? Next is the why. Why did the condition or disease arise? So oftentimes, descriptive studies provide clues about the cause that can be pursued with more specific research design. So for example, there is a case series that links, let's say, ano bang example? Let's say, in a certain factory, there is an unusual incidence of allergic conditions, no? So this will prompt the company, particularly the company doctor or their safety committee, to investigate what is the cause of that increased incidence in allergies in their factory. And usually, these are descriptive studies that try to investigate that. And then later on, once you've described it, then it will give you clues as to what is causing that that cluster of new conditions, no? In more sophisticated research design, usually either a case control study or even a cohort study, no? Which I will give you more examples later. Next is the where. Where does or does not the disease or condition arise? Usually here we describe the geography, no, the environment on where the disease is very common, urban versus rural. So for example, in Japan, no, after the Hiroshima bombing, after several months to years, they noticed the rise in incidence of congenital defects, which they link to the nuclear explosion during the Hiroshima bombing. So other examples, no? For example, when people live close to rodents and insects, and thus their parasites has significantly shaped both medical and political history, like the bubonic plague, no? Ano pa ba? For example, if you live in a floody area, no, there is high incidence of leptospirosis in the rainy season, no? There's also been studies where they observed that living where drinking water has high fluoride protects against dental caries. And that's how they discovered that fluoride actually protects you, no, from dental caries, because of the initial descriptive studies that have described the link between the low incidence of dental caries and the degree of fluoride content in the water. Another example will be latitude. No? Latitude plays a part in both multiple sclerosis and vitamin D because sunlight can help decrease, no, the incidence of multiple sclerosis and vitamin D deficiency. But in turn, there are also certain latitudes that have an increased cancer risk because of the exposure to sunlight as well. As we know, for example, in Australia, they have a high incidence of skin cancer because of really the degree of sunlight exposure that they get exposed to, as well as also their characteristic as Caucasian individuals. Next, when is the condition common or rare? No? So time provides important clues about health events. So an example would be, for example, you are involved in food poisoning after ingestion of a staphylococcal toxin. Usually after several hours, there will already be an outbreak of gastroenteritis among those who were exposed. So for example, after a birthday party, you see sudden increase in visit to the emergency room because of acute diarrhea, and then you notice that it came from just one birthday party. So you see the temporal relationship between the two. Another example would be, so this temporal relationship can be as short as that, no? Food poisoning and then gastroenteritis, or it can also be long, no? For example, they've observed that in women who had intrauterine exposure to DES or diethylstilbestrol, usually this is from, if I'm not mistaken, this is from a pesticide, no, that was very commonly used in the past, no. They discovered that after several years, these women had a higher incidence of vaginal adenosis and clear cell carcinoma. So sometimes the temporal relationship is not close to one another. Another example would be HPV and cervical cancer. Usually the latency is very long, but they have established that association through longitudinal descriptive studies. There are also certain conditions that have regular seasonal patterns, as we've observed. No? So influenza, they've noticed already that in this time of the year, let's say October, September, November, that's your country's flu season, you already note the increase in incidence of consultations or hospital admissions for influenza. But the sixth implicit question, or the 6W, is so what? So what means what is the public health effect, no, of the health phenomenon that you've observed in your descriptive study? What is the importance of that? Are you just randomly adding some information that have really no significant impact in the society? So that's important also, no? When you are trying to do a descriptive study, no? Is the condition a current and timely one? So an example of that would be, of course, COVID, diba? So a lot of studies on COVID were initially descriptive studies, just describing the condition, no? Because that's already important in public health planning. So is this condition serious? Are large numbers involved? So for example, we have observed already in COVID, no, that large numbers are involved, especially in our country. No? Are its societal implications broad? Has this been studied before? No? Or are you just doing the descriptive study just for the heck of it? No? It's very important that when you undertake a study, you're trying to add, not just to add to the knowledge, but also to have significance also in adding to the scientific body of knowledge. So there are several types of descriptive studies, no? So descriptive studies can describe certain individuals or populations, no? The more common ones would be your individuals. So individuals, in the descriptive study that describe certain individuals would involve this kind of study. So if it's a case report, usually it's just one patient, no? A rare condition, a rare presentation, or an unusual case, no? Case series will be several individuals. Cross-sectional study is a group of a small population or a sample of the population, and surveillance. So we'll discuss that one at a time. In terms of population would include large numbers of people. Like for example, the whole of the Philippines, that's the Filipino population. No? Studies that describe populations would include ecological correlational studies. So the case report usually begins with an observant clinician that reports an unusual disease or association, and this prompts further investigations with more rigorous study design. So in the past, an example of this would be a clinician before reported a benign hepatocellular adenoma, no, a rare tumor, in a woman who had taken oral contraceptives, and they tried to do a large case control study on this, and this confirmed a strong association between long-term use of high-dose pills and this rare hepatocellular adenoma. So it began with just a case report, and then they expanded it to a case control to really confirm the association. So an example also would be, let's say, the first case of, oh, never mind, later na lang. Journals who publish case report are not as common anymore as before, because most journals are not that interested anymore in case report. But there are certain journals that are interested in publishing special case reports, because really they're also very important, especially if the disease is evolving. No? The disease is evolving. It's a very, very new disease, or it's an uncommon disease and you don't know how to treat that uncommon disease. Usually, we look at case reports and see how other people have treated that unusual disease. So for example, for me, I had a case before of thyroid storm in pregnancy, not very common. So I was trying to look at clinical practice guidelines. There was nothing. I tried to look at observational studies. There was none. So I ended up with looking at case reports and how they treated individual patients with thyroid storm who had it during pregnancy and how they treated it. So I tried to learn some information from that, and I applied it on my patient. No? So there is a devoted journal called the BMJ case reports, that is devoted to just publishing certain description of rare cases. So these are some examples. So for example, successful surgical resection of a rare case of a giant sacral chordoma, no, a multidisciplinary feat, no, enteroatmospheric fistula repair in Ehlers-Danlos syndrome type 4, a novel management technique using Abra device. So these are, you don't see large studies on this. No? These are just individual cases that we can all learn from. And then once you've done several cases of this, you can actually combine it to case series, which I will discuss in the next couple of slides. Some case reports are not really something that, it's not always the rare cases, no? Sometimes it's, let's say, a new intervention that you tried on a patient that has not been tried before. That's also an example of a case report. Or something, a description of something that takes the boredom out of the medical literature. This is an example of that. This is the case. This is a case report of the man who overdosed on placebo. No? I always present this as an example. No? So guys, if the Zoom meeting ends at after 40 minutes, you just reconnect. Okay? We'll just reconnect. So this is an example of a case report. This is a 26-year-old male that overdosed on a drug while he was enrolled in a clinical trial of antidepressant. No? And when he overdosed, he had hypotension, he had difficulty of breathing, no? Tachycardia, very symptomatic. And then later on, when he was unmasked, he realized that it was, they told him that he only overdosed on sugar pills or placebo. The blood pressure went up to normal. He felt okay, no? It's not something rare, but it's something worthwhile to describe, no? That's why it was published in a case report. Next, so if we combine several individual cases in one report, we have a case series report, no? Usually when you observe the appearance of several unusual similar cases in a short period, it heralds an epidemic, no? An epidemic is simply a phenomenon that occurs in excess of what is expected. So it's an epidemic. It doesn't mean that it has to be like thousands, no, or millions of people developing the disease. But for example, if the expected rate of, let's say, some rare form of blood disorder is 1 in a million, and then you observe in your hospital that there are already 5 cases, no, in your hospital, no, that's already in excess of what is expected, and that can actually be considered already as an epidemic. So a classic example will be what it was this case, no, a cluster of homosexual men in Los Angeles with a similar clinical syndrome, no, that alerted the medical community to the AIDS epidemic. So they observed that certain homosexual men were developing rare carcinomas like your Kaposi sarcomas, no, and they wondered why only among homosexual men, no, and it triggered a further investigation, and that's when, because Kaposi sarcomas are not very common, no, and also pneumonias that were not very common during the time, let's say pneumocystis carinii pneumonia was very uncommon, no, in otherwise young individuals. But because of this epidemic, no, in excess of what is expected, they investigated it and it alerted the medical community to the AIDS epidemic, no, in North America. So the value also of your case series report is these cases can be used in a case control study. So you have the case reports, no, the cases in the case report, and then you compare it against those with the absence of disease and look at the factors associated or not associated with the occurrence of that disease. So I think you have a separate lecture on case control study. Another type of descriptive study is your cross-sectional or your prevalence study. So cross-sectional studies provide a snapshot of the population at a particular time. So what's the classic definition of a cross-sectional study is that the dependent and independent variables or all the variables are collected at one period in time. That's the definition of cross-sectional studies. So cross-sectional studies are neither prospective or retrospective. It's just taken at one period of time. That's why it's just a snapshot, no? So it doesn't really give us a temporal association between two factors. So cross-sectional studies can also be done in smaller populations. No? So an example of as a cross-sectional prevalence study would be this one, then the 8th National Nutrition Survey Study. This is a regular national survey that is done by the FNRI. No? So this is, so meron tayo nung, the latest one is 2013. I think this is supposed to be every 5 years, but they're already delayed by several couple of years. So the last one was in 2013, and before that 2008, and then 2003. So it gives us a snapshot of the nutrition status of the Filipino population in 2013, no? And since this is a parang longitudinal survey, then you can compare the snapshots of the population throughout the years, no? So, but it can also be done, no, cross-sectional studies can also be done in smaller populations. So an example would be this one, no? So in a Puerto Rican pharmaceutical factory, they noted a high prevalence of gynecomastia among employees. So they hypothesized that there might be something, no, in that factory that is causing the increase, no, in estrogen levels, causing this gynecomastia. And true enough, when they tested the serum concentrations of estrogen in their employees, they noted an increase in serum concentration. And that further added to their hypothesis that something, no, in the dust, no, the exposure to ambient estrogen dust in the plant might be the cause of the gynecomastia. There's also another similar study, no, among refugees. They observed that a certain group of refugees had a high incidence of gynecomastia. It's not very common kasi gynecomastia, especially among males, no? And they noted that they tried to investigate that, and they found that it was the ingestion of tainted food that was tainted with estrogen that increased the incidence of gynecomastia among that group of refugees. So there. So that's the cross-sectional prevalence study. So for example, in this example, they saw that they got the group of people, let's say a population of all the employees, and they observed which ones had gynecomastia or had no gynecomastia, and they looked at the serum concentration of the estrogen at that period in time, no? And correlated whether those with gynecomastia had elevated serum concentration of estrogen and or not, no? And then also tested the presence of estrogen dust in the factory plant. So that's why it's cross-sectional. Is the data is only taken at one period of time. Okay. This is another example of a cross-sectional study. This is a local study done by Dr. Mia Fojas. No? This is a cross-sectional survey where they gathered a group of patients with type 2 diabetes, no, with a certain criteria. And then that group of patients with diabetes, they tested, no, for certain complications, no. So ito yung mga newly diagnosed only within the past 3 months. And then they tested the presence for diabetic neuropathy, diabetic nephropathy, no, through several tests. And they only tested it at that one period of time. So they did not follow up the patient, let's say after 1 year or after 2 years, whether they developed. So because this is just a cross-sectional study, they only took the factors at that one particular point in time. And Dr. Mia Fojas just described how many had neuropathy, how many had proteinuria signaling diabetic nephropathy, how many had diabetic retinopathy, how many had hypertension, how many had obesity, how many had presence of left ventricular hypertrophy at that period in time when these patients were here. So I was discussing to you an example of a cross-sectional survey devoted to a small population. And in this study, that small population are newly diagnosed patients with type 2 diabetes. No? So in this small population, at that one period of time, they noted how many had the different complications of diabetes, such as peripheral neuropathy, peripheral vascular disease, hypertension, diabetic retinopathy, diabetic nephropathy through the presence of microalbuminuria or macroalbuminuria, as well as presence of LDH or ECG, and presence of obesity and dyslipidemia. So this was just taken in one period of time, meaning they did not do serial measurements. So that's why this is called a cross-sectional survey, and they did not do associations. No? So purely just describe, no, this population of newly diagnosed patients with diabetes. So what they found in this study was that there was a high prevalence of diabetic complications and cardiovascular risk factors at the time of diagnosis. No? So this study, although it's just a descriptive study, is a very commonly cited study whenever we're discussing diabetes in the Philippines, because just on this study, we know that at diagnosis of patients with diabetes, they already have high rates of complications and cardiovascular risk factors. So in the past, descriptive studies have been discouraged to do, but for me, descriptive studies are very, very important. An example of a descriptive study that we recently did was the clinical profile of Filipino patients who were diagnosed with COVID-19 in the Philippines, who were hospitalized for COVID-19 in the Philippines. So we enrolled hospitalized patients with COVID-19 from Luzon, Visayas, and Mindanao, and we were able to see the trends, no, in our own population. And in that study that we did recently, we noted that fever was an uncommon presentation, meaning having the absence of fever is not a reliable symptom of ruling in or ruling out the presence or absence of COVID-19. No? And also, we saw how doctors were treating patients with COVID-19 by looking at how many received, let's say, dexamethasone, how many received certain antivirals. No? So it gives us a snapshot of that population of hospitalized COVID-19 patients. No? So I hope when you do think about doing your own studies, you should also consider doing descriptive studies as well. Very easy to do. No? Another example of a descriptive study is a surveillance study. So in a surveillance, from the word itself, no, these are studies that watch over our community, no? So strictly speaking, the definition of surveillance is the ongoing systematic collection, analysis, and interpretation of health data essential to the planning, implementation, and evaluation of a public health practice, closely integrated with the timely dissemination of this data who need to know. No? So a key feature of surveillance study is the feedback loop. For example, during a surveillance study, you see that there are high rates of, let's say, diarrhea in a certain community. So it signals the public health officials in that area that we need to investigate further and also institute an intervention in order to prevent the further increase of diarrhea in that certain community. So the surveillance helps inform, no, the public health officials, no, to plan and implement a healthcare program, no, or an intervention, no, in order to improve the quality of care in that particular area. So surveillance study provide information which can be used for priority setting. No? So for example, we see the presence of high maternal mortality rate, no, in our country, or let's say in a certain province. Then the public health officials in that province would prioritize the delivery of safe obstetric care among mothers who are delivering their babies. So that's how important surveillance is in, let's say, priority setting. Policy decisions, planning, implementation, even resource mobilization and allocation, prediction, and even early detection of epidemics. So surveillance studies are also used for monitoring, evaluation, and improvement of disease prevention and control programs. So for example, if you're evaluating vaccination programs, we monitor, no, the different diseases that are supposed to be prevented by vaccination. So, for example, recently we've seen outbreak of measles in that community. It means that the vaccination program in that community is probably not carried out efficiently, meaning there might be low rates of vaccination for measles. Diba? Remember the recent polio outbreak, no, in Mindanao? So supposedly polio is in the being eradicated already in the country, where we are only one of the few countries who have polio left, no? Supposedly we've eradicated that, but just 1 or 2 cases of polio is already considered as an epidemic, and it helps us evaluate our current vaccination program for polio and hopefully lead to improvements and reinforcement of the prevention and control programs. That's why there was a new drive in polio vaccination among children aged 5 years old and below. So that's the importance of surveillance studies. So an example is the Philippine Integrated Disease Surveillance and Response. So this is a nationwide network of surveillance in the country, no, that help our DOH, no, to plan our healthcare programs. So surveillance studies can either be passive surveillance studies or active surveillance studies. So an example of passive surveillance would be death certificates. Remember that the DOH publishes the top 10 causes of mortality in the Philippines, or the top 10 causes, top 10 causes of mortality. And that top 10 causes of mortality is actually based on what we report in our death certificates. No? We also have communicable disease surveillance. Active surveillance, on the other hand, are surveillance that search for active cases. So an example of active surveillance would be our COVID, no, surveillance. No, we actively search for cases through screening, no, contact tracing, active case detection. No, these are examples of active surveillance. So another example of active surveillance would be your DOH notifiable diseases. No, I think we've discussed this already for your, I don't know, PMCH 1, I think. But if not, no, these are diseases that have been identified that you have to either notify immediately or within the week. So for example, in your hospital, you have a case of meningococcal disease. You have to report that within 24 hours, and it will alert the public health authorities of a possible outbreak or an epidemic of meningococcal disease. No? These are category 1 diseases. Weekly notifiable diseases, no, are these diseases, no? These are category 2 diseases. So within the week, every week, all the hospitals and healthcare centers report whether they have a reported case of this or not. Okay, so these are mandated by an executive order from the DOH. So another, remember that descriptive study also describe populations, no? So the type of descriptive study that describe populations are ecological correlational studies. So that's an example. So ecological correlational studies look for associations between exposures and outcomes in populations rather than individuals. So large scale ito. No? So for example, you're just trying to look for correlation between certain factors to generate a hypothesis, no? So an example would be death rates from coronary artery disease are correlated with per capita sales of cigarettes. So you're trying to look at the hypothesis that cigarette use increase coronary artery disease. So you can look first in ecological correlational studies. So for example, in 2019, these are the sales of cigarettes. The trend is going down because of the um, anti-tobacco smoking campaign, and also that law, what do you call that law? That the tax, sin tax from cigarettes, no? So they will see, so I forgot what year, let's say the year was 2015. They will see the trend in the sales of cigarettes, and they will also look at the death rates from coronary artery disease at that period in time. So that's an example, and see if they are correlated with one another. So you can generate the hypothesis that with the reduction, with the reduction in with the increase in the taxes for cigarettes, it results in the decrease in use of cigarettes. Therefore, decreasing the rates of coronary deaths from coronary artery disease. But this is just hypothesis generating studies. It doesn't establish causation, no? An important limitation of this kinds of study is the inability to link direct exposure, to directly link an exposure to an outcome in individuals. So, for example, in this example, we cannot directly say that the cigarettes directly cause the CAD. But of course, we know that already. But you need more rigorous study that can establish the link between cigarette use and coronary artery disease. No? Because in ecological studies, no, we cannot control confounding because the data is already there. Okay? There are certain correlations that have been done in the past that constitute ecological fallacy. There appears to be a correlation between two factors that when you think about it, it's not really logical. No? For example, death rates from coronary artery disease also correlate with the number of color television sets per capita. No? But when you think about it, that the use of TV causes coronary artery disease, no? Parang medyo malayo na. No? That's an example of an ecological fallacy. The correlation should also make sense. No? But if it doesn't make sense, it's just a fallacy. Okay? So what are the different uses of descriptive studies? So we can do trend analysis, no, to monitor the health of our population. So for example, diabetes prevalence. So this prevalence of diabetes is based on the regular National Nutrition Survey. So you can see from the trend, no, comparing the different national nutrition surveys in the country, that there is an increased trend from 2003 to 2013. You know? So you will see that you might need to also prioritize non-communicable diseases such as diabetes in our country. So it helps our public health officials to plan. No? That's why before kasi DOH was really mostly focusing on communicable diseases, infectious diarrhea, pneumonia, polio, tuberculosis. But because they observed that there is an increasing prevalence of non-communicable diseases, they also they also shifted, no, their priorities to address NCDs as well. No? That's why in the health center, no, they've increased the access to drugs for diabetes, hypertension, cholesterol, because they realize that the non-communicable diseases also add to the burden of disease in the country. And there's also been a shift in the top 10 causes of mortality in the Philippines. Before, it used to be infectious causes, but now, no, tumataas na yung mga MI, stroke, no, in the top 10 causes of morbidity and mortality in the Philippines. So that's how we, this kind of study, no, help monitor the health of population. So corollary to that, no, healthcare planning is also um, um, a byproduct, no, of the information that we get from this descriptive studies, particularly our surveillance study. And this descriptive studies, no, the surveillance study also provides us with clues about what could be causing, no, the uh, the trend in that phenomenon. So these are examples of early leads from descriptive studies that gave us clues to the underlying cause of that observed phenomenon. So as I mentioned earlier in an earlier example, no, a clinician was able to observe hepatocellular adenoma, no, adenoma, no, versus hepatocellular carcinoma. Hepatocellular adenoma, a rare tumor, but also sometimes deadly, no, was observed in young women, and they looked at what is the commonality in the underlying association was actually exposure to high dose oral contraceptives. And this actually changed, no, how oral contraceptives are manufactured nowadays in order to reduce the risk of hepatocellular adenoma. Another example would be the observation of blindness in newborn infants. So they observed that in newborn infants that became blind, no, there was actually high ambient oxygen concentrations in the incubator. So they observed that this underlying cause, it's the one causing blindness. So as I mentioned earlier, they also observed, no, the rise in incidence of Kaposi sarcoma in young men, and they noted the commonality in these young men were homosexuals, no, and they were able to eventually discover that these young homosexual men were actually infected with a novel virus at that time, which is your HIV-1 virus. Another example would be the cluster of angiosarcoma of the liver in employees, no, in a certain plant, industrial plant. And they discovered that the industrial exposure to vinyl chloride led to the cluster of angiosarcoma of the liver in those employees. And that's when they banned the use of vinyl chloride. And lastly, the presence of cardiac, heart defects, and deafness in newborns. And then when they look at that cluster of newborns with that certain syndrome, they look back what were the maternal exposure of the women. And they discovered that all the women had maternal infection with rubella during pregnancy, and they were able to establish the association of maternal rubella with the presence of congenital rubella syndrome. So these are some of the examples of early leads from simple, probably just beginning with case reports or case series, no, that alerted doctors to further investigate, no, for any common association. And then your descriptive studies have several advantages and disadvantages. So the more obvious advantage will be often the data are already available and thus inexpensive. So for example, you're doing a case report, you just have to go back in the chart and review the chart, no? And then write it up and then make your case. No? And usually descriptive studies don't really have much ethical difficulties because you're not really introducing an intervention to these patients. The disadvantages or limitations of your descriptive study would be overstepping the data, meaning over-interpreting from what the data is actually just saying. So for example, your data is just describing, you cannot over-extrapolate from that. No? So you may be able to see some temporal association. So for example, a high prevalence is observed in this certain exposure, no? After being exposed to this certain exposure, but the associate or that exposure cannot be as certain as the direct cause, and the outcome is not the direct effect. No? So meaning, it doesn't mean that they're temporally associated with other, that factor A causes factor B or the effect. No? So the cause and effect relationship might be still unclear if you're only doing a descriptive study. So a temporal association is not equal to causal association. Please remember this in descriptive study. So just describe. That's it. Okay, just describe. Increase in trend, decrease in trend, an increased trend is associated with a corresponding increased trend in factor B. No? So to summarize, no, descriptive studies are often the first tentative approach to a new event or condition. If it's something new, it would be suffice to just do a descriptive study. No? Health administrators use descriptive study to monitor trends and plan for the utilization of resources. But epidemiologists, no, and clinicians generally use descriptive reports to search for clues of cause of disease, no, in order to generate certain hypotheses and test this hypothesis in using more rigorous study design, such as prospective observational studies or even randomized controlled trials. No? Common pitfalls would be of these types of study would be the absence of a clear, specific, and reproducible case definition and interpretations that overstep the data or interpreting beyond what is just being described in the data. Okay? And the absence of a comparison group do not allow conclusions about the cause of the disease, no? Or conclusions whether an intervention is effective or not. So for example, there is a certain patient with, let's say, brain cancer, and that patient used Boston C, no? Very popular, Boston C. And the patient gets cured, no? When in fact we know he's having chemotherapy at the same time. You cannot conclude that Boston C actually caused the regression of the brain cancer without the presence of a comparison group. Okay, I think this is my last slide. So I hope I was able to explain to you what descriptive studies are about. So they just describe, as simple as that. Okay, so are there any questions from the group? Let me check the chat box.